Welcome, everyone. I am Dr. Danielle McDonald, Associate Vice President and Dean of Students at the University of South Florida. I have a wonderful group of colleagues here who will share some information about how USF is preparing for fall in respect to COVID-19 mitigation. Our goals are to inform you of USF practices in order to help you as families prepare your student to come to campus. We know that there are many concerns and questions. So as you listen, feel free to submit questions in the chat, although we may answer it during our presentation. We will organize them and answer as many questions as possible before the end of our time. We will also provide web links for you to refer back to after the session. The session is being recorded and will be on the Parent and Family webpage for future reference. So I am going to start with Dr. Peterson. Dr. Peterson, you're the Dean of the College of Public Health and the Chair of the USF COVID Task Force. USF has been applauded for the great job we did in the 2020-2021 academic year in keeping our COVID numbers low and our community as safe as possible. As you know, a lot of our success was due to the restrictions and requirements we placed on our community. Many of those mitigation strategies have now been lifted by the state. So can you share how USF makes their decisions regarding protocols and how we can continue to mitigate the threat of COVID, especially in light of the increasing numbers in the state?
Thank you, Dean McDonald, and good evening, everyone. I'm delighted to be with you today. I want to start by thanking everyone who has worked with me. We have a fabulous team that has come together over these past 18 months. We look to the science, the data. We have a lot of experts at this institution. We're very grateful for that, and they help guide our strategies. We are also guided by the CDC and by the state of Florida. So we work closely with the Florida Department of Health and with other leaders in the state. And as part of the state university system, we take direction from the board that oversees that system. So the things we have in place coming into this fall are all guided by both the science and the directives we've been presented with. So just a few I would mention that are very important. The first is the vaccine. And we are very happy to be able to offer vaccines free of charge on all of our campuses. We've been providing vaccines since they were first made, when they were first produced, and we had a supply. And we urge everyone to get a vaccine. This is your best defense against being infected with COVID-19. It's also your best defense against getting very sick. So people who've gotten the vaccine, we now know may be infected by the current strain of the virus that we're dealing with, but they don't get anywhere near as sick. And our ultimate goal is to protect people from illness, severe illness, and even death. So we urge people to get the vaccine, and we make vaccines freely available to you on all of our campuses. Now, knowing that the vaccine isn't 100% effective against infection, the next thing that we are urging everyone to do is wear masks, to wear face coverings. In fact, we expect people to wear face coverings when indoors on our campuses or outdoors in a crowded space. And the reason for that is masks remain the best way to prevent one person from sharing the virus with other people. So they both protect you, but they protect others around you. And if we all mask up, we collectively protect ourselves. And that will allow us to get on with our college experience and do all those things that we would like to do. We also ask you to think about joining a large group event. Probably best to not do that now. Avoid large crowds if you can. We ask you to continue to practice good hand hygiene. Turns out hand washing not only helps prevent COVID-19 infection, it helps prevent colds and the flu. It's a great habit to get in for the rest of your life. We're going to keep reminding you, and hopefully it will become a lifelong health habit for you. And last, we ask you to pay close attention to your own health. If you don't feel well at all, reach out to us. You will hear from our student health director shortly. Reach out to us. Let us help you determine what may be happening. If it appears that you have COVID symptoms and people suggest that you might have COVID symptoms, we ask you to stay home. Tell us that you're not feeling well, stay home, let us guide you to your best health and the health of our overall community. We do offer testing free on all of our campuses, which you can access at any time on your own, or if we direct you to do so. So I'll stop there and turn it back to you, Dean McDonald. And I look forward to your questions. Thank you.
Thank you so much, Dr. Peterson, for this information. I know the task force is very concerned about the safety of our community. And as you mentioned, vaccines are a large part of keeping students from missing out on campus activities and academic progression. Dr. Sneed is our Dean of the College of Pharmacy. Dr. Sneed, as you know, there are many people who are concerned about getting the vaccine. You've been working in the community to dispel myths and educate on the vaccine. Can you share with our students and families what you have been sharing in the community to address these fears?
Absolutely. Dr. McDonald, thank you very much. And I also want to once again send kudos out to my great friend, Dr. Peterson, for really doing one of the most wonderful jobs, not only in Florida, but across the entire country, and really mitigating and leading us through COVID-19. As Dr. McDonald mentioned, I'm Dr. Sneed. I'm Dean of our College of Pharmacy. And in full disclosure, before I go any further, I want to make sure everyone knows that I am a co-investigator on a clinical trial for a COVID-19 vaccine with the company Novavax. And I just want that to be part of my disclosure to you. But out in the community, many people have had many questions about the safety of the vaccines. And I just want to be very clear and very honest with all of you and very transparent. The currently available vaccines that we have on the market right now, number one, they are not brand new. They have been studied now for well over 25 years, and we've been building over a 25-year period what we call the platform for how we can develop the vaccines. This really ramped up around the year 2010 when we realized, and many people don't remember, but we had another pandemic in H1N1. And we realized back during that time period that we couldn't wait 2 or 3 years if another pandemic that was more deadly, and it turned out H1N1 was not that deadly, should it actually become more deadly in the future. And so the current vaccines we have on the market, I can share with you, we have studied well over 200,000 people in clinical trials among 4 companies that are candidates in our country alone. Around the world, we're approaching well over 500,000 people in clinical trials that are studied. And to date, we have given over 400 million doses, 350 million doses here in our country and around the world with the very same vaccines, well over 400 million doses. And during that time period, much of the safety concerns that many people have had or thought about really have not panned out. Out in the community, from a safety standpoint, many people really want to know what will happen to me long term. Well, again, and here at the University of South Florida, we offer the Pfizer vaccine. And so number one, people want to know, well, what about future fertility issues? Well, during the clinical trials last year, not only for Pfizer, but for all of them, many women were actually became pregnant after receiving the vaccines. And the doctors descended upon them and followed them out. And a year later, I'm very proud to tell all of you that the mothers did fine, the children have done fine. And during that time period, the FDA, since we had the emergency use authorization here in our country, has continued to follow tens of thousands of pregnant women. And as of today, we still have not seen any signal that would indicate that there will be any challenge or any problem with fertility in women. In terms of men, we have found even greater things that I can get into a Q&A, but there has been no issue at all in terms of fertility for men. So I just wanted to make sure we talked about that. Very quickly, people always ask me, well, if I've already had COVID-19, should I still get the vaccine? And I say, absolutely, you should get the vaccine. We have tailored the currently available vaccines to cover a little bit more of what we call that spike protein, that little red kind of mushroom or broccoli looking thing that we see on TV. We've tailored the vaccines to cover much of that, and we can't guarantee the quality of the antibodies you may have built from the natural or what we call wild type virus. That's number one. Number two, a number of people who actually went on to get long COVID symptoms after they got vaccinated from being infected have actually reported feeling much better. And so we want to make sure that you have a requisite number. We call that a requisite number, a minimum number of antibodies, because you can become reinfected. And we want to make sure that we're covering you as much as possible with the known strains out there. And by the way, having more of the antibodies has not proven to harm any one individual that we know of. And then some of the other myths that I kind of hear about, and people, you may have heard about, will the Johnson & Johnson vaccine cause a problem, or we had an issue with a few men that had myocarditis or inflammation of the heart tissue. Well, once again, I'm here to report, number one, if you heard about Johnson & Johnson, we were concerned that there was an association with the vaccine, but we only found that association in 17 women out of over 8 million doses that were given. So it's extremely rare, and quite potentially there were other conditions that may have led to the challenge. When it came to the heart conditions, and we found that primarily in men, and again, in well over 60,000 doses given, we found that happened in about 500 individuals. And for each one of them, and I did follow all of them through the FDA, I can share with you that all of them resolved, and there's only one case I know of, and I just haven't been able to follow up to figure out what happened with that one case. But again, 60,000 doses given, 500 people, no long-term effect, and within 10 days, every one of them was back to full strength and had no lingering problems. So the vaccines are very safe, they're very effective, they're not brand new, they've been around for over a 20-year period. This is the first time that we have actually used them out in the public, and we used them at just the right time because we had to. But I look forward to many of your questions about the vaccines and anything else you may want to ask me. But again, I'll turn it back over to Dr. McDonald, and thank you very much.
Wonderful. Thank you so much, Dr. Sneed, for all of that really important information. And I think what's important about that and to talk about it here is because our families are often, the parents of our students are often the ones who are helping their student make the decision as to whether to get vaccinated or not. So we wanted to make sure that we were sharing this information so that as families, you can all make this decision together and that you will all have the information together. So Anna Hernandez, one of the, I'm sorry, yes, make sure that I'm going in the right area. Yes, so Anna, one of the strategies we're employing to keep our campus safe is in our residential population. As the Assistant Vice President for Housing, can you share the move-in process for our new and returning students for the Tampa campus and the St. Petersburg campus? And can you also share what happens if a residential student is directed by Student Health Services to isolate? And what if they are directed to quarantine? And I know Dr. Puccio will spend some time talking a little bit about what those mean. But in terms of a residential student, how the students are coming in, and then what happens while they're here, that would be really helpful.
Well, thank you for the opportunity, Dean McDonald. The move-in process, both for the St. Petersburg campus and the Tampa campus, are well underway. We have had our summer students move out and some of our break students transition in, and we are expecting our early arrivals to begin on Sunday, so just a few short days away. The move-in process will actually be a week-long process on the Tampa campus from August 15th through the 22nd, and a 3-day process from Wednesday the 18th through Friday the 20th on the St. Petersburg campus. This year we are expecting to be full, so over 800 students are expected on the St. Petersburg campus, and approximately 6,000 students living on the Tampa campus. We have put into place many mitigation strategies to try to spread out the crowds, avoid crowds, reinforcing the messaging that has already been given with regard to encouraging vaccination, encouraging and expecting mask wearing, social distancing, hand hygiene, avoiding crowds, etc., just to keep our communities safe. We are expecting the largest number of people to arrive on Thursday the 19th, probably on both campuses, and Friday the 20th. Probably well over half of the students will be arriving on those 2 days. So as one of the strategies is to avoid crowds. And so if you have the ability to arrive earlier, we certainly would encourage consideration of that. We are discouraging people from arriving on the 21st and 22nd because on the Tampa campus, we will be having our graduation ceremonies on those days. And so we're trying to not mix crowds as well. But the move-in process on both campuses will involve, the first step is really making your move-in appointment so that we know who is arriving when, and we can spread folks out. For Thursday and Friday, we have 5 different locations on the Tampa campus, a single location on the St. Petersburg campus because of the volume. But the first step is really the health screening, and Dr. Puccio will talk a little bit more about that. But that is just to get a sense of who it is that's arriving on campus, what their COVID history is, their vaccination history, what their current symptoms are, et cetera. We certainly, if anybody is feeling ill, whether it is the student or anybody that is in their party, we are really asking people to stay away from campus because there's no reason to spread that, whatever it may be, a cold or COVID, into that population. We're asking for patience. It could take 10 or 15 minutes to go through those individual health screenings, but we're doing that in order to understand whether or not it is safe and appropriate for the person to move into the residence halls. If they are given the clearance from student health, then we will proceed and check them into their space. If it is that a student is not feeling well, so that if they're symptomatic, then they will be then a rapid test will be administered to them. If it is that they test positive, then the student will be asked to return home if they are able until they finish their isolation protocol. If it is they are not able to do that, then we would be able to accommodate them on campus. If it is that they test positive through that rapid test, or they have another reason that they have tested positive, then isolation, positive tests for isolation is the people who would be eligible to go into the halls. If it is that a student has been exposed to a positive case, then those are individuals who would be expected to quarantine if it is that they are unvaccinated. If they're coming to campus vaccinated and they have been exposed to somebody that is positive, we do not expect that they will be required to quarantine at this time. The guidance may change, but if they are unvaccinated and exposed, then they would be required to quarantine. Quarantining would require the student to leave campus, and that's whether they're a residential student or a non-residential student. They would not be permitted on campus in the dining halls, campus rec, libraries, classrooms, or certainly in the residence halls. And so it will be up to them to make those arrangements for an off-campus location to fulfill the up to 10 days of that quarantine period. Housing and residential education on both campuses takes our guidance from Student Health Services. We are not making the determination as to who needs to isolate and who needs to quarantine, but we are there to try to support the students that need to isolate and also adhere to the quarantining expectations if it is that they need to leave campus. So we are here to support those who are in isolation, and that will include meal delivery. We have a system that is set up with regard to package delivery, but the only people that are permitted in the isolation hall would be the student that is needing to isolate. We say isolation, but I do want to share with folks that it is very likely that students that go into isolation will have a roommate. It would be another positive person that is going into isolation because we have limited spaces, and if there is demand, we want to make sure that we're able to accommodate as many people as possible. But we are really trying to work with our community and try to mitigate either the quarantine or the isolation circumstances that may occur by really encouraging people to get vaccinated, to wear masks, to stay away from crowds, practice good hygiene, and communicate to us if it is that you're not feeling well.
Thank you, Anna. I know I went a little out of order, but I want to thank you for that information. And I really want to stress to our students and our families that you need to develop your plans now for the situation where your student is directed to isolate or quarantine. Already I'm seeing the questions in there about what happens if an out-of-state residential student is asked to quarantine. And that will then be up to the student and the family to determine where the student does that quarantine, because they will not be able to do that on campus. So plan now for where they will go and what they need to bring with them in order to be comfortable. Don't wait until it happens. Dr. Puccio is our Executive Director of Student Health Services. Dr. Puccio, you and the Student Health Services are crucial to the health of our student body in normal times, but especially in terms of this COVID-19 response. Can you talk a little bit about the services that Student Health Services is providing in terms of testing, symptom tracking, vaccinations, and quarantine and isolation on each of the campuses? And then what is it that you are seeing and hearing from your fellow medical professionals in the state?
Thanks, Dean McDonald. It's an honor here to be here this evening, to be here with all of you to answer your questions. And I wanted to do a little assessment about the virus that we're currently seeing. I've been involved with Student Health Services at USF since the beginning of the pandemic, and we are seeing something very different than we have seen in the previous 18 months. The virus is really affecting the younger populations. When this pandemic first started in March of 2020, it was mostly the older populations. However, that is not true now. The virus in this fourth surge in the state of Florida is really affecting the people that are between the ages of 20 and 50, probably the hardest, but also the adolescent population is also being affected. We are seeing in Florida, as well as my colleagues across the nation, we are seeing students in the adolescent age population and the college population being admitted to the hospital at numbers that we have never seen with this pandemic. We are seeing people admitted to the intensive care units and being intubated at numbers we've never seen. We are also seeing complications in the young adult population that we have never seen, including they're experiencing something called COVID toes or COVID fingers, where there's blood clots that are developing, and the blood clots are so severe that they may actually have to be, the toes and fingers may have to be amputated. And these are things, like I said, we have not experienced before, and it is very serious. And all of these people that are experiencing these complications, the vast majority, close to 99%, are people who are not vaccinated. The vaccinated people may be getting ill, but they're not the ones that are getting hospitalized. They're not the ones getting intubated. They're not the ones in the intensive care unit. So we do know that even though there are breakthroughs in the vaccine, the people that are vaccinated are doing reasonably well, and they're not experiencing the significant consequences of an infection. Now, with that said, how does Student Health Services help our students stay healthy? Well, one of the things is that we have services that are set up that not only provide in-person services, but anybody who is concerned about having any symptoms related to COVID, we have telehealth services that are available. Very often these services are available, more often than not, these services are available same day. And how you really get an appointment, there's several different ways. First of all, you can call and just schedule an appointment saying, you know, I have cold symptoms, I'd like to see a provider. But there's also two other ways to really be connected to the services at Student Health Services. There is the Assess COVID at usf.edu. And if you're concerned that you may have symptoms, that you may have been exposed, or maybe somewhere you got tested off campus and you tested positive, and you want to report that because you're concerned and you want to speak to a healthcare provider, any of those resources you can use, and they'll help you get connected with Student Health Services. The other thing that we have is something that we did use last year, and that was our daily symptom tracker. And if you report that you, again, if you have symptoms, if you may have been exposed, or if you're tested positive, in the daily symptom tracker, our nursing team would be able to reach out to you, evaluate what's going on, and if necessary, get you scheduled for an appointment as soon as possible. And when you have an appointment, what's going to happen? So you're going to see one of our medical providers, and they're going to do an assessment of what's going on. They're going to assess if you've been exposed. What are your risk factors for the exposure? Have you been vaccinated? And based on the information that we receive, we're going to give you advice. We're going to give you advice on whether you need to get tested, whether you need to quarantine, and whether you need to isolate. And as Dean McDonald and Ms. Hernandez mentioned earlier, is what are these terms? What do they mean? Often we're using those terms interchangeably, and they really can't be used interchangeably because they have very definitive meanings. Somebody that is quarantined or needs to be quarantined is somebody that has been exposed to somebody with a confirmed diagnosis of COVID-19. So they're exposed. So we will follow the CDC and the Florida Department of Health guidelines for quarantine people. Now, on the USF campus, people who are deemed quarantined, that they have to quarantine, will need to leave campus. Even if they are residential students, they need to leave campus. And I know Anna mentioned those in details, and if there's questions specifically, we can go into more details. Somebody that is deemed need to isolate really means that the person has tested positive for COVID-19 and they need to be in isolation for 10 days, 10 full days. They need to be in isolation. And then on the 11th day, if their symptoms, mostly their respiratory symptoms have resolved and their fever have resolved, they will be released from isolation. However, a student may need to stay in isolation longer than 10 days if they are still experiencing respiratory symptoms, because it's the respiratory symptoms that are the most contagious. So if you're sneezing, you're coughing, you're going to need to stay in isolation until that resolves. Now, you're not going to need to stay in isolation if you are still having the loss of taste or smell, because those symptoms don't necessarily are not contagious to people. And if you have any more specific questions about isolation and quarantine, I'll be more than happy to answer those in the question and answer session. I did cover how you report, and again, I'll just mention those. There's 3 ways. One is to call student health directly. The second is to use the assess COVID at usf.edu. And the third thing is our daily symptom tracker, and you could report those. Now, we also mentioned that as part of the move-in process, we want to do a move-in process that keeps everyone as healthy as possible. And because of that, we looked in many different ways of how we can do that. And we really felt that doing a health screening during the move-in process was probably the most effective way of doing this. Now, during the health screening process, you are actually working with student health services. And because of that, you are in a medical setting, and you will need to wear a mask during this whole health screening process. We are going to be asking you to fill out a questionnaire that will be asking you some specific questions about travel, about symptoms of COVID. Have you ever tested positive for COVID in the last 12 months? And if you want to, you can give us your vaccine you can give us your vaccine information. Based on the information that you give us, we will be able to make an assessment whether you need to go for rapid testing, whether you need to schedule a testing in 5 days, or whether you can move on and just move into housing with no further actions. But it's going to be important that we look at that health screening to be determining that, and we may need to ask you more questions once we review that. And we ask for your patience, and we do ask that you just make sure you keep your social distance. Try to keep 6 feet apart from people. Make sure that you have your mask on at all times. We will have hand sanitizer available. So if you borrow a pen After you're done borrowing the pen, please use the hand sanitizer. We're hoping that we will have enough staff on place that we will be able to get you through the health screening process in a very quick manner. We used the health screening process during the summer move-ins, and it went relatively smoothly. We made some improvements to it to make it even move faster. So we're looking forward to a smooth move-in process because we're all very excited to have everyone back on campus. And we want to just make sure that we do it in a safe manner so that your experience with your first few weeks of classes is a safe and productive one. And I know that there's probably a lot of questions that I may not have covered. I know that there probably is big questions about testing and vaccines. And on all of our campuses, we will have access to testing. On the St. Petersburg and the Sarasota campus, we will have specific days for testing, but we also have our health services that are available to test if there is a significant reason to test on a daily basis. In Tampa, we have access to services all 5 days a week on business days. We also have lots of services around our campuses to get testing outside of business hours. So if you're very concerned, there are plenty of places to get tested around any of our campuses. All of our campuses will also be sponsoring vaccine events each week. Each campus will have vaccines available. In Tampa, we will be doing vaccines on Tuesdays and Wednesdays. In Sarasota, we'll be doing vaccines on Wednesdays. And in St. Petersburg, we will be doing vaccines on Tuesdays. If there's any kind of other special need that we can't fit you into our schedules for whatever reason, there are plenty of places that are providing vaccines. On the Tampa campus, USF Health at the Morsani Center has vaccines available 6 days a week. So that's another option for all of our students, faculty and staff as well. I think I covered a lot of details there, and I may have talked really fast. So please don't hesitate to ask any questions that you may have in the question and answer section, and I'll go through it more in detail. And I'd like to turn it over back to you, Dean McDonald, and thank you again for this opportunity to talk to you.
Thank you so much, Dr. Puccio. I would now like to talk a little bit about campus life and what to expect. While our student organizations and our programming departments are looking forward to getting back to in-person campus activities, they are also concerned about spreading the virus. And so we're trying to balance providing what students want from their college experience, but also doing those in safe ways. So you may see some programming move to later in the semester, or some changes being made to some of our traditional programming. There will be masks and hand sanitizers available and encouraged at all of our events. We've also seen the value of virtual programming, so we will continue to offer some programming in that way. Our student organizations are incredibly excited to get started back up again and to welcome students into their organizations. They have been allowed, while the university is not mandating masks, student organizations are allowed to mandate masks at their events, their meetings, and their programs. So students should be prepared for that. And the student organizations are being told that they should publicize that when they are publicizing their events. Our classes are being offered in the same percentage of modality as we had in 2019 before the pandemic. So we are offering mostly face-to-face classes, but also some online and some hybrid classes. When students registered for classes, they should have been able to see how the class is being offered. Any decision to pivot to any temporary remote instruction will be done under the direction of the Board of Governors. I also wanted to let students know that if you are directed to isolate or quarantine, you are responsible for contacting your instructors and informing them that you have been directed to not attend classes until Student Health Services releases you. You should ask your instructor what provisions are being made for students who cannot come to class. Please be aware that each instructor has different policies regarding absences, and an online option may not be available for that class. I am working with the faculty to identify other ways that they can continue to support students who are having to be isolated or quarantined and not in the class, and be able to support them in other ways, even if they are not able to offer the class materials remotely. These, of course, are all important reasons to get vaccinated and to wear masks, as you have heard all of my wonderful colleagues talk about. So we are now going to start to tackle the questions that are coming in from our students and families. I'm going to try to group the questions together, and I will direct them to one of my wonderful colleagues here. But Dr. Peterson, I'm going to start with you. There have been quite a lot of questions in here about our statement that we sent out yesterday about expecting students to wear masks. And what does that really mean? Are students going to be mandated? What happens if they don't wear a mask? So those questions, and then they're also asking about whether vaccines are mandated. And if we have all these concerns, of course, you know that there are two sides of people who want to get back in person and going, and others that think that maybe we should be starting remote. So I've grouped a lot of questions there for you, Dr. Peterson.
Thank you, Dean McDonald. Great question. So as I mentioned in my my opening remarks, we have been guided by data, the experience of the virus on our campus and in our communities, and the directives we received from the state. So as part of the state university system, we are not mandating vaccines. We are not mandating face coverings. We are, however, urging people to get the vaccine, as you've heard all of us say, and we are expecting people to wear face coverings, at least through this fourth wave, because it is, there's a significant risk, as we've all said. This particular strain of the virus that we're dealing with now, very easily transmitted from one person to other people. And the best way to stop that is by everyone wearing face coverings. Not mandated. If you would rather not, choose not to. We're not going to make you. But we chose this language very carefully. We expect everyone to share in the collective responsibility to keep all of us safe. I think it is fair to say that it is highly likely that any indoor classroom or other building that you're in, there's likely to be someone in there who is at extreme risk for severe consequences if they are infected with COVID-19. So as a courtesy, as a kindness, respect for people who you don't know and you don't know their history, we're asking everyone to wear face coverings because it is the best way to transmit the virus at this time. As Danielle said, we are a large university, we are a diverse university, we have lots of different perspectives and opinions, and we do our best to try to accommodate all of those different needs. So as was mentioned, some of our classes are available online. And that should have been apparent when you signed up for classes. Some have the ability to offer a remote option, but not all do. And that's why we're asking you to be as prepared as you can be if you are, for whatever unfortunate reason, unable to attend class for a week or two. We have asked our instructors to do their best to accommodate you. I saw some of the questions in the chat. It is possible, it's not likely, but it's possible that if you have gotten the vaccine, you could be exposed and you could develop symptoms. And if you develop symptoms and test positive, you may be asked to isolate. We would isolate you on campus, of course. But that's unlikely. If you're vaccinated, it's not 100% protective, but it is protective. So hopefully we can accommodate that group of folks. And again, we'll work through this together. We'll find the best ways we can to make sure that no one loses progress, that their academic journey is not disrupted. And we're going to do our best to make sure that all of our students have the best experience they can have. But we are going to manage this disease because that is also our responsibility. Thank you, Daniel.
Thank you, Dr. Peterson. Dr. Puccio, I know that you spent a great deal of time talking about the quarantine and the isolation process. But I think that I'm still seeing a little bit of confusion between what is isolation and what is quarantine. And the length of time, how people should know how long they should isolate or quarantine. Can you give some specifics on that again?
Sure. Thank you again for asking the questions out there. When we talk about quarantining, that means that somebody has been exposed to someone with a laboratory diagnosed COVID-19 infection. So, according to the CDC guidelines, what we are considering for quarantining is that someone would need to quarantine for 7 days, but they need to get a test at day 5 to make sure that they haven't tested positive, and then they would need to go into isolation. Okay. Now, if for any reason there's some issues going on, they can't get tested, somebody can be quarantined for 10 full days, and they do not need to get tested. We really strongly discourage that because we want to make sure that you can resume your academic studies as quickly as possible. We don't want this infection to interfere with your academics as much as possible. So that's why if you are considered quarantined, you do need to quarantine for 7 days, test at day 5, and when we get the test results, we will release you from quarantining. Now with isolation, I gotta say, is a little more clear cut. Isolation means you've tested positive, you must isolate for 10 days, and you will be released on the 11th day. If you're living on campus, you can isolate on campus. If you are told that you've quarantined, you will have to leave campus. I hope that really kind of gave the specifics. I wasn't sure if there was any other parts to quarantine and isolation that you wanted for me to address, but I think I covered most of it. So I'll send it back to you, Danielle.
Thanks, Dr. Puccio. I'm not going to let you off the hook yet. I have some questions about the vaccine cards. Should students bring it with them? Is there some place where it can be uploaded? Are we collecting them? Does everybody have to show their vaccine card as they enter campus? Can you talk a little bit about how we would manage and what students can do in terms of their vaccine records?
Well, that is a great question, and it's a really important question. I'm going to address this in different sections. For students that are moving onto campus to live in residential housing, we are going to give you the opportunity to share with us if you've been vaccinated. We are not mandated. We are not allowed to mandate you to give us that information. We are not mandating people to be vaccinated to come to campus. Again, I'm going to say this, which we probably heard a million times already tonight. We strongly encourage everyone to be vaccinated, but it is not mandated. Okay, so if you're moving on to campus, as part of your health screening, you're going to be asked, have you been vaccinated for COVID-19? And if you did, if you want to share us that vaccine information so that we could have that available in case there's a situation, which I saw a question in there, which is important. If for any reason, say you have a roommate that tested positive and you've been vaccinated, our first line of screening is that if you've been vaccinated, you don't need to quarantine. Okay. However, if we don't have that information, the first thing that we're going to do is we're going to have to set up a telehealth appointment for you. You're going to need to meet with a provider who's going to do a full screening process. And if you don't tell them that you've been vaccinated, then you're going to have to quarantine. We don't have any process unless you're willing to share with us that you've been vaccinated. So I just want to put that out there, that the more that you share, the easier the process that we could have if there's ever an exposure process that's going on. Now, for those of our students who may be listening to us tonight who will not be living in residential housing, it's a little more challenging to get the information to us. But if you want us to know that you've been vaccinated, you can contact Student Health Services and say, listen, I would like to let you know that I've been vaccinated, and I'd like to give you my information so that you have it on file in case there's an exposure in a classroom or something of that sort. And you can contact Student Health Services by calling our department. But if you go onto our website, there are many times where you could reach out to our clinic, even through email, and submit that information. If you are a part of our MyChart app, which is part of our electronic health records, you could actually send a message to our nursing staff with the information, and we can have that added to your chart as well. So there's a couple of ways that you could upload it, but as a university, we are not mandating the collection of that information, and I just wanted to share with you how you can share it with the university in other ways. And I think that should cover the mandate part. Back to you, Danielle. Thank you.
Thank you, Dr. Puccio. Dr. Sneed had a few questions still about the vaccine. One of the questions was about this concept of booster shots and whether those would be needed. Another question was, if I've had COVID and I have all the antibodies, do I still need to be vaccinated? I think you talked about that, but we can reinforce that. And let's start there while I look to see if there's any other questions for you on that.
Absolutely. I think that's two good starter questions. The first thing I really want to share with all of you, the most dangerous part of this particular virus is not coming into contact with it. The most dangerous part of the virus is when you do come into contact with it, and now it begins replicating inside of your body. It has a very high replication rate, and it can actually cause organ damage to many of our internal organ systems. Very often when we look on TV, we see people in the hospital, in the ICU, they're on, ventilators, but it can affect very, very many organ systems in your body. It can affect your heart, your intestinal tract, your kidneys. And so the whole idea behind getting vaccinated is to make sure that we have that antibody army already in place, so that if you come into contact with it, it can actually bind, what we call neutralize, but bind onto the virus, and therefore not allow it to attach to the organs in our body and begin to replicate so we can transmit it to other people. So I think it's very important to understand that when we talk about boosters, as of right now, and the CDC and the FDA are monitoring this very closely. I look at their reports every week. And so in the current fashion, what we're talking about is the fact that right now, we feel that most people have enough antibodies from the current vaccines that were given to bind onto any of the virus that you may come into contact with and prevent this replication inside of your body. Now, we are anticipating that sometime in the future, one of two things may happen. Number one, we may need to give you a booster shot to raise your antibody levels back up so that we have that antibody army ready to go. Or number two, we may need to update the current vaccines that will match up more appropriately to whatever strain or variant we're dealing with at that time. So at this current moment, we're going to follow the science, we're going to follow the CDC. When it's time for booster shots, a recommendation will come out, and we will be ready and prepared to offer boosters to whoever wants that booster to occur. But it's really important to understand right now, getting the booster shot up front is the most important thing. And Danielle, remind me just very quickly the second part of that question.
If I've had COVID and I have all these antibodies, do I still need to be vaccinated?
Yeah, so again, we encourage, if you've already been infected and you've recovered and you're doing well, we encourage everyone to continue to get vaccinated. Again, the way that the vaccines have been manufactured, they more appropriately cover the entire virus. which we're wondering if you've been infected, if your body produced the same antibody to cover the entire virus, number one. And then number two, we want to make sure that if you had a very small exposure, you may not have built a very large amount of antibodies. We know that if we give you the amount of vaccine that will produce a certain amount of antibodies, then we know you're going to be protected. So even if you've already had it, we want to make sure that you have enough antibodies to shut down the replication inside of your body so that number one, we can protect you. But then number two, and most importantly, we have to shut down transmission from one person to another. If we don't shut down the transmission, we run the risk of running into another variant that one day may escape the current vaccines. And if it escapes our vaccines, that means it will escape the antibodies you built from the previous infection you had. So that's why we're strongly encouraging wearing a mask, doing all the mitigation strategies, getting vaccinated, because we can shut down the transmission. And then eventually we feel like we can get back to enjoy the life that we all really want to enjoy.
Absolutely, Dr. Sneed. Two last questions, I think, for now on vaccines. One is, you mentioned a lot of the tests and the trials that have been done, but this is still under emergency approval, FDA approval. So can you talk a little bit about why it's still under emergency? And then another question I had is there one vaccine that's better than others that you would recommend?
Let me address the second one first. There's not going to be one that I recommend over the other. It can be very confusing when we hear the percentages and we get a sense of one having a higher percentage of efficacy over the other. All of them have been proven to be very efficacious. They pretty much produce a very good amount of antibodies. So here at USF, we have the Pfizer vaccine. It has been proven to be very effective, very safe. And so I'm not going to recommend one over the other. But number two, around the EUA, let me be very clear. We were in the midst of a pandemic that was sweeping the entire world. Over 4 billion people have been infected. And so when you have an emergency, if you have a solution to the emergency, you want to make sure that you don't spend 2 years trying to go through the normal regulatory process. Now, having said that, we did not skip any steps at all. We went through phase 1, we went through phase 2, and we went through phase 3. But we just kind of shortened the time in between them. And part of the EUA was to continue the phase 3 clinical trials. However, I want to make sure that you all know the FDA giving it the emergency use authorization is like giving a provisional approval. But during the entire time, they have collected all of the other data that nobody ever hears about. They want to make sure about the manufacturing practices. They want to make sure that we have the materials to be able to produce it safely. We want to do it without producing any contaminants as part of the manufacturing process. We need to know that we have enough glass vials to put it in. What is your transport? They want to know everything, and they've been collecting that information along the way. So we are anticipating right now, and more than likely, hopefully by the end of this month, we will have full approval after having collected more data than we've ever collected for any clinical trial in this amount of time, especially for vaccines. So we expect a full approval to come hopefully by the end of the month. If not by August 31, then hopefully in the first week of September. But I want to give the confidence that no shortcuts were taken at any point in time. As a matter of fact, they were more stringent because of the fact that we had 200,000 people that needed to be monitored in clinical trials that were being evaluated by the FDA.
Thank you, Dr. Sneed. Very helpful information. I'm going to move to Dr. Puccio next, as there are still questions, of course, about quarantines, isolations, and then getting vaccinated. So Dr. Puccio, I know that you've seen some of those questions in the chat. One of the questions, and I know that I can answer this one, which is great, is if somebody got their first dose at home in another state, can they get their second dose while they're here on campus? And then I have put in the chat for all of our viewers my little formula of if you test positive, it equals isolation. If you're high risk exposure, it equals quarantine, just to help all of our guests keep those two things in mind. But if you could talk more about the isolation, quarantine, and the questions that are coming up around that.
Okay, thank you, Dean McDonald again. One of the things that I think is important to talk about, which I've neglected to talk about so far, and then I'll get to more of the quarantine and isolation questions, is number one is if you've tested positive for COVID-19 in the past 12 weeks and you get exposed to somebody else during those 12 weeks, you do not have to retest and you do not have to quarantine, because during those 12 weeks, there has been evidence that has shown that you should be able to fight off another exposure to the virus. So you would not have to quarantine and you will not have to test if you've tested positive for COVID-19 in the past 12 weeks. I will also, during the health screenings on campus, we will also be asking that question as well. As far as some of your other questions that you asked about, if you received your first dose of the vaccine in your home state, would you be able to receive it when you come to campus? So the answer is yes, all around. There's a few conditions that we need to talk about. If you're out of state, it is absolutely essential to have your vaccine card with you, because we have no way of finding out in the state of Florida if you are vaccinated or you received your first vaccine in the state of New Hampshire or in Montana or in Alaska. This country does not have a interconnected vaccine log. We only can do it within our state. So if you show up and say you had vaccine number 1 in Massachusetts and you don't have your vaccine card, there's nothing I can do. I can give you another shot, and that's going to be your number 1 shot as far as state of Florida, until you can get us access to your vaccine records from your original state where you got them. Now, the question about really comes into play as far as which vaccine that you got in your original state. On all of our USF campuses at Student Health Services, we can provide 2 vaccines. We can provide the Pfizer vaccine and we can provide the Johnson & Johnson vaccine. You don't need to update your Johnson & Johnson if you received it in another state, because it's only a 1-dose vaccine. Okay, but I did want to get it out there that we will offer the Johnson & Johnson vaccine. Now, if you received Moderna from another state, we currently do not have any sites that we're going to be doing Moderna. We were offering Moderna over at Sarasota, but our supply, we've not been able to get new supplies of Moderna. However, I have surveyed pharmacies around each of our campuses, and I do have specific CVSs around the Tampa campus, around the St. Petersburg campus, and around the Sarasota Manatee campus that does give Moderna. So we could assist you in finding those pharmacies, and they all have ample supply to be able to give you that vaccine. So the real problem is, like, if you have Moderna, you may want to reach out to your Student Health Services for your individual campus so that we can give you further direction of where you can go to receive the Moderna. But Pfizer you could receive on any of our campuses. And I think that's what you wanted. I'm not sure if I left something else out.
That's great, Dr. Puccio. Thank you. I'm going to turn to Anna Hernandez next. Anna, you know, the information that we gave about our residential students and being able to provide isolation for them, but not quarantine for them, of course, has led to a lot of questions. So specifically, we've got questions from parents of minors wanting to know what would happen with them. And then what are some of the ideas that families can start thinking about now to plan for if their student has to leave campus.
Very good. Thank you so much. So I'm going to start my response with trying to reiterate the quarantine and isolation difference just once again. So those who are required to isolate would be individuals who themselves have tested positive for COVID. So these are positive individuals that will be required to isolate. Okay. For those students, we will have a discussion with them. If it is that they are able to safely do so, we would encourage them to go home. One of the reasons that we do that is because students will find, I mean, when you're sick, you find comfort being around those who are familiar with you. However, if it is that the student is not able to return home or it's not safe to do so, we will provide isolation on campus in a building that we have designated for that purpose. Okay? So that is what isolation is. People who are positive, whether they're vaccinated or unvaccinated, if you test positive and you are a residential student, while we would encourage you to return home if safe to do so, you will have a place on campus, unless we max out the entire building that we have designated. But we have more spaces that are allocated on our campus than any other SUS throughout the state of Florida. So, so we are trying to make sure that we are able to accommodate those who are positive for COVID so that we're not sending them into the community randomly to fend for themselves, okay? For those who are expected to quarantine, those are most likely those individuals who are unvaccinated and are considered a high-risk exposure, meaning that they have been in contact with somebody else who has tested positive within 6 feet, not wearing masks, that there is a high-risk exposure. They themselves are not positive, but they have been in contact with somebody who is positive, all right? If it is that they're vaccinated, those individuals at this time are not required to quarantine. They will be able to go about doing their normal campus business. If it is that a student is unvaccinated and they are a residential student, they will be required to leave campus and make their own arrangements for the 10-day quarantine off campus, whether that is that they return home, whether it is that they stay with friends, with other family members, whether it is that they develop a plan to go to a local hotel, okay? So we can assist in that process. If somebody is not able to make their own hotel arrangements, et cetera, we have arrangements with local hotels that will accept students, and we can make those arrangements for them, and then we would just bill the student's account directly. So if a student doesn't have a credit card or there's some logistics that they need that assistance, we're happy to help them do that. It's not that we're kicking people to the curb, right? These are all of the things that are complex, that are conversations that, as Dean McDonald had recommended early in this presentation, those are conversations that you really want to have with your family, with your student, whoever is listening today, so that everybody knows what's ahead for them. So are you going to return home if it is that you test positive? Are you going to return home if it is that you're required to quarantine? Will you make arrangements at an Airbnb? Will you make arrangements at a hotel? Is there somebody else local that you might be able to stay with? So we're really encouraging people to take ownership of whatever those plans are for themselves, okay? But we will try to assist in facilitating finding somebody a place if it is that they have tried all of those things on their own and they're having difficulty for some reason, whether that's that they're out of state and they're not familiar with the hotels that are in the area, they're international students, and if there's a language barrier or credit card issues or whatever that may be, we will be happy to facilitate that process with trying to find locations off campus. We would just ask that, when you're contacted about quarantine, if it is that you don't have a plan and you need assistance, let us know and we will reach out to those individuals. Okay, so that's sort of where that is. I just want to have clarity with regard to who it is we're talking about and what it is that means. Unfortunately, and I'm trying to be upfront with people, is that for those who are unvaccinated and continue to be exposed to positive people, they could be different positive people, could be in an organization, it could be in a classroom, wherever it may, could be at a grocery store, wherever that may be. It is possible that people may need to quarantine multiple times, and each time that happens, that's the arrangement that you'll need to make. So we're really trying to encourage people to think about that, have those conversations, find out what you feel comfortable with. But I do want to have you take away that if it is a student test positive, that it is a resident on campus, whether that be St. Petersburg campus or the Tampa campus, where we have housing that is available, those individuals we will accommodate on campus in our isolation hall. Does that help?
Thank you, Anna. I think that should help a lot.
If I may, I saw some other questions, and because I'm talking about housing, I did see some questions about families and the move-in process in some of the questions. So I do want to let you know that at this time, we are permitting families to help with the move-in process. They will not need to go through the individual health screening that Dr. Puccio and I have described. That is specifically for the students. We do ask that people not be part of the move-in party if it is that they're not feeling well. And while they're here on campus, we would expect our guests, those that are helping out, to also practice good hygiene, social distancing, as well as mask wearing. But they will be permitted in the residence halls. There is not a limit with regard to the number of people that are able to do that.
Thank you, Anna. That's very helpful. Okay, Dr. Peterson, I am going to turn to you with some tough questions. We do have a lot of families that may not live in the state of Florida or may not be aware of the guidance of this state. And so there are questions about how we're balancing what we talk about with the research and the science. But we're not offering our university classes remotely or hybrid. We are still going to offer activities, and we're not requiring masks or vaccines. So can you help our families understand where the university is in terms of trying to make those decisions?
Thank you, Dean McDonald. I will do my best, and I appreciate the questions, and I understand it can be confusing. So we are a state university. We are part of the state university system. We follow directives from the board that governs the state university system. We also follow all applicable Florida law. And the state of Florida has been open for some months now, and there is an expectation that the state universities be open in the fall and offer the typical array of classes in the typical modes of delivery. So as Danielle mentioned earlier, we are offering a class schedule that looks much like the class schedule in fall 2019. So there's a mix of in-person and online classes, as there always is. And because we've learned a lot through this pandemic about technology and how remote meetings like the one we're having now can actually work, we have been working to equip our classrooms with that technology so that more and more of our classes could be offered in ways that are flexible in meeting the different needs of our students. So some students very much want to be in a classroom setting in person. Others would prefer to connect remotely in real time like we're doing now. And we are continuing to work toward having that capability across all of our courses. As I mentioned before, we're a large university, 3 campuses, 12 colleges, 50,000 students. It's a lot of work, but it is something that we are actively pursuing. But in the meantime, until we are directed otherwise, we are intending to open as scheduled. And we are trying to accommodate the different needs of our students. I've seen a couple of the questions in the chat. There are people who would prefer to not come to campus. We certainly appreciate that. And if there's a possibility for you to change your schedule to be in more online classes, or if you have a particular need, you can reach out to an instructor. I think the majority of our instructors are eager to work with our students, but we just can't offer every class in a mode that everyone can access that they would like, if that makes sense. So there are some classes that can be delivered that way and may be. And we also may find that there are certain classes that do move to temporary remote instruction, just as a result of circumstances around any particular class. So something may be going on with a professor that requires them to go temporarily into a remote mode. There may be situations with positive cases and numbers of students having to be contacted about their potential exposure. So there are things that are going to happen. You'll see that happening throughout the semester, and we just ask you to work with us and be patient with us as we work through this. But right now, as part of the state university system, we are not mandating vaccines, we are not mandating masks, and we are not, at this moment, we have not made any decision to begin the semester in a full remote mode. Now, I also mentioned we follow the data and the science, and as we have in the past, if we reach a point where we believe that is a necessary step, we will consult with the board that oversees the state university system to see if that would be something we would be allowed to do. So we try to do the best we can with the science, with the experts. You see 4 of them on this screen, plus me, and yet we must follow the directives that are made to us as a state institution. And I see my colleague, Dr. Sneed, would like to make a comment as well. If you want to shift to him.
With Dr. Peterson, I just wanted to very quickly kind of add on to every comment you made. And one thing that I really appreciated last year when we were in the midst of the pandemic unrolling was the fact that we had great citizenship on the entire campus from all of our students and our faculty and staff. We all pulled together, and when we looked to our left and we looked to our right, and we had that bull spirit, we really found people that were wanting to watch out for each other, and it led to having one of the lowest infection rates, not only in Florida, but probably across the entire country. So I just wanted to add on to your comments, and it was a very clear observation I think I had and you had very clearly, and Dr. Puccio and everybody else. So and we're hoping that all of us coming on campus will remain being those great campus citizens, because if we do that, then we can get back into living the life that we all want to live. So I just wanted to reinforce all the comments you just made.
Great. Thank you all for that. I did want to address where we are over time, and so I want to thank my colleagues for being willing to stick around. But I did want to answer a question that came in about our non-residential students. We have been spending a lot of time talking about what happens in the residence halls if a student has to isolate or quarantine, but I have been asked to talk about what happens to students that are not living on campus. So Dr. Puccio, could you talk a little bit about those supports as well?
Sure. So if a person that lives off campus is basically determined for the need to quarantine, that means that they cannot come to campus. They cannot use any of the university services. They can't use the library. They can't use campus recreation. They can come to campus to access student health services, although they can get tested, and if once they cleared, then they can actually come in to see a provider in student health services. But outside of the health services, the student cannot utilize any other services on campus. If they're isolated, again, we would want them to stay off campus. It does get a little trickier in trying to navigate if you live off campus and you have a roommate. And then we would work with the 2 students to navigate what can we do for somebody that needs to quarantine or needs to isolate, or someone that needs to isolate and then their roommate needs to quarantine because of the exposure. So many times we do try to encourage people to separate if possible. And that may be the person that has to isolate because they tested positive may go home, or the person that quarantined decides to go home. A person that is living with a person that has been diagnosed with COVID-19, the longer they stay in contact with them increases their risk for developing the infection because of the exposure of the viral load from the person that is positive to the person that is an exposure. So I know I'm using a lot of technology, but pretty much what we try to do is we really try to talk to both roommates if they are off campus to let them know what are their risks, particularly for the people that are exposed, of staying with someone that does test positive. And we try to reach out to both as soon as we diagnose somebody as having an infection, we do contact tracing. So the roommate will be contacted to explore with them what needs to be, what options are available for them, what they need to do for their quarantine. And the fact is, again, like I said, you may want to make decisions to leave your current roommate that is positive because your risk of developing the infection may increase the longer you stay with them. I'm not sure if there's any other questions associated with that, but I did want to kind of go over that contact tracing element.
Yeah, Dr. Puccio, thank you for bringing that up because there have been some questions about the contact tracing with classes. And so how will I know if my roommate is positive, or how will I know if I've been exposed? Will I get contacted even if I've been vaccinated or not? Can you talk a little bit more about that contact tracing?
Yes, thank you. That's a great question. So if someone is exposed either through a roommate, I think I'll start off with a roommate first because I think it's a little easier. When we do the process of contact tracing, we ask very, very specific questions of who a positive person has been in contact with in the last 48 hours. So we want to know about roommates, people that they may be involved in different activities around campus, different buildings that they may have gone into, and of course we will ask about classroom exposures. Okay, if there is a classroom exposure, the next thing that we will do is we will reach out to the professor to find out what are the situations in the classroom. We will then look into finding out who's in that class, and then we will do an assessment to determine any information that we may know if a student has been vaccinated. Because if a student is vaccinated in a classroom exposure, they do not have to quarantine. But if they're unvaccinated, we have to do a little more detailed contact tracing, and we're going to need to set up appointments for them to meet with a provider so we can explore the contact tracing and determine if a person needs to quarantine or not. So unvaccinated people are going to be, they may be contacted numerous times throughout the semester, depending on their different exposures and if they've been exposed to a particular positive person, whether it be a roommate, classroom exposure, it could be exposure in the Marshall Center, it could be exposure in the library. Any information that we find out that that an unvaccinated person may have been exposed, we will explore that and we will reach out to the person. Now, many times with a large exposure, such as in a classroom, what we will do is we will do an initial assessment and then we will give guidance to the professor to send out to the entire class so that the entire class may know what's going on. We try to do that in every scenario where we have it, where we are aware of the positive person being in a class, so that people may make decisions that are best for them. So maybe if they want to get tested, they may decide, you know what, I need to get vaccinated, I need to get tested. We want to be able to inform the people of what are the opportunities that they have available to them, what they need to do because of the exposure, and but most importantly, we want to let them know in a very timely fashion. I'm not sure if Dr. Peterson may want to add anything to what I have said, but I think I will turn it over to her to see if she wants to add anything.
I was typing answers to people's questions, so I don't know what you just said.
I was talking about classroom exposures, and I was talking in regards to that we tried to get an announcement out through the professors as quickly as we can so that we could update the students on what the assessment is and what they would be likely required to be able to do.
Right, right. So yeah, so thank you, and that's some of the questions I've been responding to in the chat. So when we learn of a positive case in a classroom, we immediately step into gear. We contact all the professors of that student is taking classes, and we begin the work of trying to figure out if there have been any high-risk exposures in that classroom. And this is a labor-intensive process, and it sometimes takes a while, but that's why it's very important if you get a call or a contact from someone from the COVID assessment team that you respond as quickly as possible, because what we're trying to do is reduce the transmission. So we need to know who may have been exposed and is therefore at high risk. If you have gotten the vaccine, even if you're exposed, you are not at high risk and you will not be asked to quarantine. If you're not vaccinated and you were not wearing a mask and you were in close contact with that person, you are a high risk exposure and you may be asked to leave campus to quarantine. You will be asked to leave campus to quarantine. But sometimes we don't know about a positive case. Sometimes people get tested off campus, particularly if they live off campus, and we don't necessarily know. And that's why we ask students to please let their instructors know, and then the instructors tell us. So we're trying to capture all the knowledge that we can. We're trying to learn about every case, either because we know it, because we did the testing, or because you tell us. And you telling us, again, allows us then to work with you, work with your professors, try to make sure that we can find ways to help you keep up with coursework as best we can. So it is important that you tell us, because we also want to make sure that you haven't been exposed to other people, but it's also, we need to know so that we can provide you the best support that we can. It was a good question.
Great, thank you. I also want to highlight that not participating in the contact tracing, not being forthcoming about positive tests, not abiding by quarantine or isolation are all violations of our student code of conduct, because they are compromising the health and safety of our university. So I do want to make sure that our students and our families understand that. It's incredibly important that our students abide by all of those mitigation strategies that we are trying to use. I'm going to let each of my colleagues take a minute or two to close out, and then I will close out this session as well. So I'm going to turn to Anna Hernandez first, and then Dr. Smead, and then Dr. Peterson, and then I will close this out.
Thank you so much, Dean McDonald. So we have shared a lot of information and a lot of complicated information. It is a complicated time that we are living in. Our focus is trying to keep our community safe and also return to the robust USF experience that we all have grown to love and expect. One of the things that I want to share with you, and I know that there have been several links that have been included in the chat, but several people have asked questions about it would be good to send an email. It would be good to have some of this information in writing. I really want to encourage you to read the information or ask your student for the letter from Dean McDonald, because that has a lot of great links in it that was sent out yesterday. There's a message from the university. The university has a COVID mitigation page. And so if you just Google USF COVID mitigation, it will give you all of the details with regard to isolation versus quarantine and what those expectations are. From the housing perspective, USF Housing, we have a page specifically about isolation. So as you're having these conversations with your families about whether or not you want to stay on campus to isolate, or whether it is that you would prefer to return home, I would suggest that you Google USF Housing Isolation, and you'll see the frequently asked questions, and it'll give you some information as to what that experience might look like for you. If you still have any questions with regard to the move-in process, again, just Google USF Housing Fall Move-In, and you'll be able to see the information there. And it will talk about the move-in appointments and the locations and the health screening, and all of the different, parking, all of those other things that are not COVID related that happen every time we do a move-in process. But I do want to encourage you to go and seek out that information if it is that sort of all of this was a little bit too much to handle, from the sensory overload. We have a lot of information that is available in a lot of different locations. And so I just want to encourage you to educate yourself on the resources that are out there. And then if you have any questions, please feel free to reach out individually, and we will do our best to get you the answers as quickly as we can. So we look forward to welcoming you back to campus and hope everybody stays safe and healthy. Thank you. Am I throwing it to Dr. Sneed?
I think, yeah, I was going to say, and I'll jump in right behind you just to keep things going. Again, I want to thank all of our guests for attending this evening. I always enjoy the opportunity to present with my colleagues here. I do want to reiterate just a few things I mentioned before. Again, I go out in the community a great deal. I know there's a great deal of misinformation and opinions about the vaccines. I know it feels to many people like they happen rather quickly, but again, we've been studying for this moment for over a 20, maybe even a 25-year period now. After over 400 million doses given, we can share with you that the safety profile is proven. I was talking with a group of students a couple of weeks ago, and I kind of compared it to, if many of you recall, when we had the Motorola or Nokia mobile phones versus what we have now, in either an Android or an iPhone. We have come along with new technology, better technology, a safer technology, and the vaccines have proven to be safe and effective. And so we really want people to consider strongly getting vaccinated. And as information comes out, we here at USF Health and USF overall, we remain committed to providing you transparently with all the information that we have available. And so once you do arrive on campus, if you hear that myself and Dr. Peterson, if we're doing a town hall about the vaccines or just COVID-19, we invite many of you to come and join with us. And in the unfortunate event that you really come into contact with the virus, Dr. Puccio has proven time and time again how much he truly cares for the health of all of our students here on the campus. And so I think you're walking into an environment that is community driven, that really wants the safety and the progression of all of our students. So thank you all again. And I will pass it on to, is it going to be Dr. Puccio? Okay, Dr. Puccio, it's all yours, my great friend.
Well, thank you very much, Dr. Sneed. I appreciate all the kind words that you just have given. I do want to say that Student Health Services is a service that we do care very much for our students. And we really want you to know that if you have any concerns or any questions about COVID, the two websites I want to repeat again is assess COVID at usf.edu, or you can look in the daily symptom tracker. But if all else fails, you can call Student Health Services, and the number that most people call is 813-974-2331, and you could speak to our call center, and they would be able to assess and to guide you on what's the next best steps. Student Health Services also provides a lot of other services besides COVID. And if you go to our website at usf.edu/Student Health Services, you'll be able to see all the services that Student Health Service can provide you, in addition to the COVID testing, the COVID assessments, as well as COVID vaccines. We've kind of gone through the quarantine and isolation, I think, quite a bit today. So I'm just going to pass on that and turn it over to our fantastic leader of the COVID task force, Dean Peterson.
Thanks, everybody. I'm trying to go through these questions. Great questions. We appreciate you being here, and it always helps us to hear your questions because it lets us know what we need to address, to continue to communicate, to try to enlist your support and your your partnership as we go through this. One thing that still seems to be confusing, if someone needs to isolate, we will isolate them in a building that has been set aside for isolation. They won't isolate in their own room, so you don't have to worry about their roommate. They will be in a different building or in the St. Pete campus on a different floor with a different air handling system. So all is well. And I think, as Anna said earlier, we understand this is a challenge. We understand not everyone has the means to immediately leave campus and find a place to quarantine. We will work with each and every one of our students who is in that position. And again, as I've said, I've been trying to respond in the chat, we work with the faculty. We ask you to reach out to faculty, and they very much want to accommodate our students, make sure you don't have your classes and your learning disrupted. If you need to not be coming to campus. And again, we just reiterate, we urge you to get the vaccine, and we expect everyone to wear a mask, continue good hand hygiene, and just pay attention to the communications we send out, pay attention to what's going on around you. Contact us at any time. We're here to answer your questions. We would rather have you ask than have you act on your own and potentially cause harm to yourselves or to others. We were really hopeful that we wouldn't be facing a fourth surge of the virus at this time, but we are, and we are prepared to do all that we can, again, within the limits placed on us by the state of Florida. And we can only do what we are allowed to do under state law, and we can only do what we're allowed to do by the leadership of the state system. We are a state university, part of the state university system. So we are doing all we can with what we know about this virus, how it is transmitted, how it affects people. I see a couple comments in here about masks, and I know I'm not quite sure why masks continue to be a subject of some consternation, but they do in fact keep you from transmitting the virus to other people. It's just a fact. If you're both wearing a mask, there's a far less likelihood that you will transmit the virus. And as I said on a TV show one day, yeah, they're not the greatest things in the world. Maybe they're uncomfortable, but those of you who know me, I've worn shoes that are more uncomfortable because sometimes that's just what you have to do. So we really ask you to work with us, to partner with us as we get through the beginning of the fall semester. We are excited to welcome everyone back. We are eager to try to accommodate all of your needs, and we will do our best. And we really thank you for being here. And I want to thank my colleagues who continue to do excellent work on behalf of our students, our university, and our community. So thank you, Danielle.
Thank you, Dr. Peterson. I have decided that masks are the accessory of 1920 and the 2020 and 2021, and hopefully not 2022, if we all do our part. So I want to thank all my colleagues for being willing to spend this time answering questions for our students and families. I also want to thank our Office of New Student Connections and Parent and Family Engagement for organizing this tonight. And we all agreed that it's so important that you have the information that you need to prevent COVID-19 spread and to prepare yourselves for if your student or you as the student get sick. We will continue to go in and answer the questions that people have posted. So after this, we'll go in and answer those. This has been recorded, and it will be posted on our website. So you can look at the link that we will publish as to where this will be posted. Please be aware, of course, that this has been and continues to be a quickly evolving situation. And so protocols and guidance may change. So what we are sharing with you today is what is real and true as of 8:33 p.m. on August 10th. But we do know that we will continue to be monitoring the situation and following the guidance of our state and of the science. So for the most up-to-date information, please follow our coronavirus website that is also posted in the chat. I am confident that if we all do our parts, I am hopeful for a successful, a safe, and a healthy fall. And I look forward to meeting all of you in person on campus soon. Thank you all so much. And as always, go Wolves.